Wake up, America. It's time to talk about anti-inflammatory skin medicines on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. If you're watching us on YouTube, thank you so much for joining us. If you are a first-time listener, we welcome you. And please check out our library of podcasts. We've got over, almost 500 episodes.
We're almost there.
Yeah, almost 500. So a lot of great information that we've been putting out now for over 10 years. And if you're one of our regular listeners, thank you so much. We love you. We appreciate that you are on this journey with us and that you continue to hang out with us every week. So,
wake up, America.
Wake up, America. Let's talk about these skin medicines. This is really, I think this is such a great topic because I don't think that most people understand that if they put something on their skin, it's going to absorb and get into their system.
Yeah, I think people feel like if it goes on the skin, it's less invasive than taking it orally. But the skin is your largest organ.
It is. It's your largest organ. And think about it. This is not like a sheet of metal that covers your body where you just put it on the top and that's it. It's not going to absorb. It is absorbing through your skin into that rich blood supply, your tissue, the blood supply, everything. And the big thing with that is, for me, the big thing that I've seen with our patients is when we're doing procedures, colonoscopies, endoscopies, we ask patients to please hold any anti-inflammatory medicines that they may take, like Motrin, Advil, ibuprofen. There's a whole list. We ask them to hold it for at least a week, just because of the risk of bleeding. And every once in a while, someone will call the office or someone will arrive to the surgical center, and I will always ask him, have you been off the anti-inflammatories at least a week? And someone will say, well, yeah, I didn't take my ibuprofen, but I've been putting on my Naproxen cream. Naproxen is a very strong anti-inflammatory, a very strong NSAID, and if you're putting the cream on, you're still on it. Mm-hmm. You haven't held your NSAIDs for a week because that is still going to absorb through, and that can still increase your risk of bleeding.
Now, I know one of the reasons why we tell patients to be really careful with NSAIDs, like the ibuprofen and the Advil, is because it can cause ulcers.
Right, absolutely. Well, right. That in itself, yes, absolutely. Like as I'm counseling patients in regards to some of the adverse effects that you can get from these medicines. Mm-hmm. Definitely, if there's risk, if we're concerned, and I'm always concerned. Look, NSAIDs are an enemy of a gastroenterologist, really, because of the incidence of bleeding ulcers, mm-hmm. And not just ulcers, erosions, mm-hmm. inflammation that it can cause. So yes.
So my question is, though, if you're taking it orally, and I understand why you would get ulcers or inflammation from taking it orally. Could you also get ulcers and the inflammation from taking it through the skin?
Sure.
Okay.
Sure, because it absorbs through the tissue into the bloodstream, and you're still getting the effect of what it's doing. It basically blocks certain. There's these chemicals called prostaglandins that are everywhere in your body. And specifically, like in the stomach, some of these prostaglandins will help to protect the lining, the mucosa, the lining of the stomach. But with these NSAIDs, they will block those prostaglandins, and by not having that protection is where you then can get the formation of, these ulcers, erosions, inflammation that can develop.
And the reason I ask is I feel like people think, I'm taking a pill, it's going into my stomach. The pill itself maybe digesting causes the ulcer or the inflammation, not necessarily what the chemical reaction of what the medicine is doing to the body.
Right,
so whether you take it orally or whether you're putting it on your skin,
correct,
it's still causing those same things.
Exactly.
Yeah.
Exactly. You're still going to get the effect of what those medicines do as far as blocking certain prostaglandins, those certain chemicals that help to protect the lining of your intestine, the lining in your stomach, the lining in your small intestine, because you can get ulcers anywhere. Get ulcers in your esophagus, your stomach, your small intestine, even in your colon, okay? You can get ulcers anywhere throughout your digestive, throughout the intestine.
Yeah, and just to talk about, because there's a lot of people on NSAIDs.
Sure,
a lot of
absolutely.
people taking pain meds on a regular basis. You know, they just wake up in the morning and it's just their thing. They just take a pain med because they're in pain.
Or the big one too that we hear a lot of, oh yeah, I take my Advil PM
Right, just
to go to sleep.
Yeah.
You know, and I'm just like, no. Why are you taking this pain medicine that is going to potentially hurt your intestine? That pain medicine does not put you to sleep. You know, so I don't know if they add other stuff to Advil PM, like if they put Benadryl in there to help them sleep, to knock you out. But the Advil itself is not for insomnia.
Right.
I don't know. I just wanted to say that because that's a common one I hear so much, and you know, about these NSAIDs that are PM to help you sleep. You know, but look, people buy these medicines because they're on the shelf. You can go into any store.
I think it's safe.
Right, but exactly. Because they're on the shelf, people just assume, oh, well, they're here, so it must be okay for me to take, or they wouldn't be selling it over the counter. That's not true. That is not true. They're going to sell anything that they can over the counter.
And they're going to put every label on it, AM, PM,
right?
Lunchtime, whatever.
The next thing we'll probably see someday will be Prilosec PM.
Oh my goodness.
Prilosec PM to help you sleep, which is just like for your acid reflux. But yes,
that's
look,
just marketing, people.
It is.
It's just marketing.
This is a marketing guru. I'm a marketing sucker, okay? If she sends me to the store to buy stuff, I'm going to buy the most pretty, the shiniest package
that has
you know?
the best wording on it. Yeah. No, but it is scary.
Yeah.
Okay. Like the fact that they're putting these things on the shelf, they're marketing it for certain things. People don't know. They're taking it, and these things can be hurting you.
Right.
Especially if you're taking them consistently. If you feel like, well, in this case, you know, Advil PM, you're not sleeping well. You're not sleeping well for a reason. Let's get to the bottom of what that reason is, okay? If you have pain every day, joint pain, back pain, headaches, that you're finding yourself that you have to take an Advil or a Motrin or a Naproxen or something every day, like something's wrong.
Yes.
Okay? You have to get to the bottom of what's wrong so that you don't take these medicines anymore. Okay? These medicines are just a Band-Aid. They're not fixing the problem. So please reach out to us. If you're on these medicines, we would love to help you get off these medicines. Okay? Schedule a free 30-minute wellness consult. We'll talk about what's going on in your world. See if we can help guide you in the right direction to help you start healing.
Exactly.
Okay?
And I want to add on to what Tina is saying. You may be thinking, come on, seriously, how can you guys help me? I mean, I have joint pains. I have, you know, you guys are gastroenterologists. You guys are digestive disease, digestive wellness. Well, we can help you because there could be something in your diet that you're eating that is causing the inflammation. Please listen to us. Please reach out to us because it could be something as simple as something that you're eating that you don't even realize could be causing it. All right. You could have a food sensitivity. You know, it doesn't even have to be a food sensitivity. Just things in our diets that are out there that we eat because they're there and we buy them.
And we think they're safe.
And we think they're safe. Okay. And what it's doing is causing inflammation and making you feel poorly. Okay. So yes, we can help you. Please reach out to us. Please. We're here to help you. We want to help you get better.
Yes. Amen.
All right. All right, so Tina already told you about, our link on our website. You can connect with us that way to schedule a free 30-minute wellness consult. If you haven't rated us, please rate us, give us a 5. It'll help other people just like you to find us faster. And if you haven't subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.